Good afternoon and bonjour à toutes et à tous. Today, I'd like to talk about our ongoing efforts for the development of safe and effective COVID-19 vaccines for Canada. First, I'll begin with the usual numbers update. There have been 128,948 cases of COVID-19 in Canada, including 9,126 deaths. 89% of people have now recovered. Over the past week, close to 46,000 people were tested daily, with a 0.9% of people testing positive. An average of just over 470 new cases have been reported daily during the most recent 7 days. Keeping COVID-19 under control requires constant vigilance and tireless efforts, not just by public health, but by all of us. So far, those efforts appear to be paying off, as we have planked the curve of the epidemic and the rate of infection in Canada is on a slow burn. Clearly, we can't afford to give this virus an inch, as it will take any opportunity for a comeback, as we have seen elsewhere. What we are living through now is in some ways like what generations before us experienced. In the 1940s, 50s, and 60s, communities would ban public gatherings, close schools, and the sick would be quarantined due to outbreaks of polio and measles. Most of us are lucky we have not had to live through these types of measures because of safe and effective vaccines for these diseases. As we have seen with COVID-19, prevention measures such as practicing physical distancing, hand washing, and using face masks when in public can help reduce the spread of the virus, but they cannot and have not reduced the spread of the virus to a point where Canadians can resume life as normal. What Canada and the world needs to have is the best shot at normalcy is safe and effective vaccines. The vaccine research and development process in usual times takes more than a decade before they are approved for use for Canadians. Canada and the world cannot wait 10 years for COVID-19 vaccine. By the same token, we cannot and will not compromise safety and efficacy. The development and approval of a COVID-19 vaccine for Canadians will build on the existing strengths and experience of Canada's vaccine research and safety review process. The vaccine will be tested extensively among thousands of volunteers. It will meet high standards of safety and efficacy before it is approved for use in Canada. Thanks to decades of vaccine development and advances in technology over the last 20 years, organizations in Canada and around the world are able to expedite the vaccine development process. In order to do that without compromising safety, Health Canada will dedicate additional scientists to assist with the review and approval process, and the COVID vaccine or vaccines have been given top priority at the Public Health Agency of Canada. We are committed to working collaborative with our international partners in reviewing the safety and efficacy of the vaccines. A key component of the vaccine process is Canada's National Advisory Committee on Immunization, or NACI. For over 50 years, NACI has safeguarded the health of Canadians by reviewing the research and data on vaccines in Canada and making recommendations on the use of vaccines across Canada. NACI is composed of health professionals, scientists, and researchers who review the research and ensure that the highest standards of safety and efficacy are met. In the end, the ultimate success of a COVID-19 vaccine will depend on individual Canadians rolling up their sleeves to get immunized. Widespread vaccine uptake is the best shot Canadians have at regaining some of what we've lost and returning to things we cherish. Things like holding our families and friends closely, having community events, and living our lives without the fear of contracting.
Bonjour.
Hello. Today, I'd like to talk about our ongoing efforts for the development of safe and effective COVID-19 vaccines for Canada. First, I'll begin with the usual numbers. There are 128,948 cases of COVID-19 in Canada, including 9,126 deaths. 89% of people have now recovered. Over the last week, close to 46,000 people were tested daily, with 0.9% of people testing positive. An average of just over 470 new cases have been reported daily over the most recent 7 days. Keeping COVID-19 under control requires constant vigilance and tireless efforts on all our parts, not just public health. So far, those efforts appear to be paying off as we have planked the curve of the epidemic, and the rate of infection in Canada is what I call on a slow burn. Clearly, though, we cannot afford to give this virus an inch, as it will take any opportunity for a comeback, as we've seen elsewhere. What we are living through now is in some ways like what past generations experienced in the 1940s, 50s, and 60s. The communities would ban public gatherings and close schools and put the sick in quarantine due to outbreaks of polio and measles. Most of us are lucky. We have not had to live through those types of measures because of safe and effective vaccines against those diseases. As we've seen with COVID-19, prevention measures such as practicing physical distancing, hand washing, and using face masks when in public can help reduce the spread of the virus. However, they cannot and have not reduced the spread of the virus enough so that Canadians can resume life as normal. What Canada and the world need in order to get a shot at normalcy is a safe and effective vaccine. The vaccine research and development process usually takes more than a decade. But Canada and the rest of the world cannot wait 10 years for a COVID-19 vaccine. That being said, we cannot and will not compromise the safety and efficacy of the vaccine. The development and approval of a COVID-19 vaccine for Canadians will build on the strengths and experience of Canada's vaccine research and safety review process. The vaccine will be tested extensively among thousands of volunteers. The vaccine will meet high standards of safety and efficacy before it is approved for use in Canada. Thanks to decades of research in vaccine development and advances in technology over the last 20 years, organizations in Canada and around the world are able to expedite the vaccine development process. In order to do that without compromising safety, Health Canada will dedicate additional scientists to assist with the review and approval process. And the COVID-19 vaccine or vaccines have been given top priority at the Public Health Agency of Canada. We are committed to working collaboratively with our international partners in reviewing the safety and efficacy of the vaccine. A key component of the vaccine process is Canada's National Advisory Committee on Immunizations, or NACI. For over 50 years, NACI has safeguarded the health of Canadians by reviewing the research and data on vaccines in Canada and making recommendations on the use of vaccines across Canada. NACI is composed of health professionals, scientists, and researchers who review the research and ensure that the highest standards of safety and efficacy are met. In the end, the ultimate success of a COVID-19 vaccine in Canada will depend on individual Canadians rolling up their sleeves to get immunized. Widespread vaccine uptakes is the best shot Canadians have at regaining some of what we've lost and returning to things we cherish. Things like holding our family and friends closely and living our lives without the fear of contracting the disease. Thank you.
Doctors, we will begin in the room with our questions today. Vous pouvez poser vos questions dans l'un des deux langues officielles. We ask that you limit yourself to only one question and one follow-up. Louis, over to you.
Lee Berthium from the Canadian Press. I wanted to start by asking, how many people do you believe will need to get vaccinated once we do have a vaccine for it to become effective?
Well, I think there's two aspects to that question. One is vaccination to protect the individual. So here you're looking at protection against the infection itself or prevention against serious illness and outcomes. So that could be anyone depending on the characteristics of the vaccine and the person who is receiving the vaccine. So there's no specific level for individual protection. However, vaccine is a very key component of our response because it may offer what we call community protection, where if you reach a certain level of vaccination, that might then help protect others within the community. That we do not actually know the exact level. In discussions to date, at least for regulatory purposes, that level has to be continuously evaluated. But I think the international consensus is that we should at least look at vaccines that are around the 50% vaccine efficacy mark. But each vaccine has its different margins of, confidence intervals, et cetera. So it's not a very sort of yes or no kind of answer, but one that will come as the phase 3 clinical trials, for example, the results of those become available. So I think it's a matter of remaining open to the evidence and be flexible. But what we do know is, I think even in the most affected parts of the world, the level of population immunity seems to be quite low. And so getting a high enough vaccine uptake is going to be quite important.
Yeah, Dr. Newman, if I can just add to what Dr. Tam has said. So certainly in terms of the number of Canadians, obviously if someone is at risk of severe consequences with, being of older age group or let's say having underlying medical conditions, obviously, the more people in those groups that would become vaccinated if a vaccine is available would be good. But the question of what we call community or herd protection, that's still to be I think determined because the science is not clear on that yet. Because, for example, we know a lot about other diseases like measles. So for a very contagious disease like measles, we certainly see that the so-called vaccine coverage, the uptake needs to be much higher to determine that level of community protection. For other diseases, maybe not as high a level of vaccine uptake is necessary. We don't know that yet for COVID-19, but certainly at the end of the day, I think the more Canadians that take advantage and would become vaccinated when a vaccine does become available, the better.
And you mentioned herd immunity. We're starting to hear some talk about perhaps a herd immunity strategy down in the United States, basically letting the coronavirus and COVID run free through the population to build up herd immunity. What implications would that have here in Canada if that strategy was widely adopted down in the United States?
Well, I think based on what we've seen in other countries and around the world that initially started with that kind of approach, is that it is an extremely difficult strategy because this virus has the ability, now we know, has the ability to take off exponentially in terms of growth. You have to be really careful because any increase in transmission can hit a very high-risk population pretty fast, as well as even younger populations. If you have enough virus going around, there will be severe outcomes, hospitalizations, etc. So that has to be taken into account. So, of course, in any of our decisions about public health measures, we'll just be monitoring what the epidemiology is in the United States on a very much a daily and ongoing basis.
Thank you, Dr. Tam. Next question, Glenn.
Glenn McGregor, CTV. My question is about the COVID Alert app. We're told that about 60% of the population needs to adopt this for it to really be effective at controlling infection spreads. And you're not even anywhere close to that, even in Ontario. Has this thing just been a flop? And if so, why has this not been more effective in as one of the what looked to be initially a promising tool just turned out not to be?
I'm not close enough to the project to know how effective it is, but I think give it a bit of time. You need to have people sort of pick up on and download the app. And I think some ongoing support to disseminate the information and ask the public to download would be important. And as you say, it's only in one jurisdiction right now. We're waiting to see the collaboration that can take place with other jurisdictions. But I've seen different kind of modeling and other data. So some that says, yeah, you need like 60% uptake. But others have said, well, actually, you might need quite a bit less and it'll still be effective. The way that I look at it, and that of other medical officers also, is that you don't have to have necessarily a uniform uptake in the population. But having the app downloaded in certain populations, maybe young adults who may frequent places like restaurants or other places where you don't know everybody who's around you, getting those kind of populations in those settings, downloading the app before you enter those settings. Of course, we want all public health measures to be enacted, but even policies, for example, in certain provinces where before you enter establishment, someone takes down your contact information. That's quite a laborious way of taking down contacts. It is actually quite a good way, but sometimes people give you the wrong, contact information for various reasons. But they may be quite willing to download the app and anonymously tell someone that they have had a positive test. So those kind of situations, if you can get certain segments of the population to download in a concerted way, and I'm sort of talking to young Canadians right now, is that pubs, all of those kind of settings, nightclubs, where I think at least I've heard that people haven't been putting down their names and contacts properly, please download the app, at least give it a try, because any layers of these tools to get public health a more rapid response to contact tracing would be helpful.
Just on the design of the app, though, it only works if people who test positive volunteer that information via the app through a pretty cumbersome process. They have to log on, they have to get a key code, they have to enter the key code voluntarily. I understand the numbers show an astoundingly low number of people who are using the app have actually done that. Do you think that's the rate limiting step to this? This is the fatal flaw, is that this obsession with keeping the information private means people have to voluntarily declare that they've been infected, and that really just, no one's going to do that.
I think, again, we can only encourage people to do so, because there's a balance between the way that things are designed to really be quite stringent on the privacy side, does have some downsides. And it, again, it's then up to individuals, like many of our public health measures, to actually play their part in helping limit spread. So part of this is, if you downloaded the app, you got a lab test, get that key and enter it. So that should be encouraged by all. I do think that we need to give this a little bit of time. And, as societies open, as schools and colleges and other places restart, now's the time to give it a good go. I think if under evaluation, and other provinces have to look at when they will come on board as well. So then we'll get a better sort of appreciation of how useful it is. But I think, as everybody has thought from the beginning, is not the only solution. Public health is still going to do the traditional contact tracing as fast as possible, but that this hopefully will add another tool. It was never going to be 100% perfect, but please just everybody do that. Every little bit, I think, helps. And I don't think we should dismiss it until more jurisdictions have signed on, and then we can take another look.
Thank you. Next question. Oui. Bonjour, Catherine Lévesque de la...
Hello, Catherine Lévesque, Presse Canadienne. So I'd like to hear what you have to say about home tests for COVID-19. Health Canada is now saying that it's ready to approve some of those home tests after refusing to do so for months. What explains that change? Would it allow people to better diagnose the virus, do you think?
Hey, Dr. New, merci pour...
Answer. This is Dr. New. Thank you for the question. We are always open to technological progress in science to screen for COVID-19, and we are open to all kinds of discoveries. That's always the case. It's not a change, I don't think. We are always open with researchers all over the world to find solutions. And of course, we know that the gold standard is the screening with a PCR. But other means of screening for COVID-19, well, if we're looking at those, we must, of course, validate those methods so that the results are reliable. We also know that with all of the tools available principle, which is you have to use the right test at the right time in the right place. So it's always important to use the PCR, which is the gold standard, when you need a very, very reliable result. So if you have someone who's in an ICU in a hospital or someone who has symptoms in a long-term care facility, for example, there you use a PCR test. But you can use other types of screening at home, for example, in other circumstances. Perhaps characteristics and sensitivity can be slightly less in certain screening tests than in the gold standard test. But in some contexts, if there is more frequent screening, for example, when it's really just to make sure that people are still healthy, well, there could be room for home tests. So we're not closing the door. We're always open to looking at other tools for screening.
Home testing and so on. I think the main point is that the gold standard so far really is the PCR test, and we know that, and it's been used obviously to date. And I think what's important to recognize is that it will still continue this particular test to be important to use in the right context. For example, if it's very important to critically get the result right, for example, a sick person in intensive care in a hospital, or for example, someone who's symptomatic in, let's say, a long-term care facility, you want to use the PCR. Where I think there might be a place for other types of testing modalities, other technologies, is that where certain types of testing might be done, for example, a screening on a regular basis, let's say, who knows, in workplaces or other contexts, maybe other types of tests, you could be using them in those kind of contexts, because the drop-off, to be honest, in terms of what we call the sensitivity, specificity, the test characteristics, may be made up by how it's used in those kind of contexts for populations which are otherwise healthy, in which you might expect, let's say, a lower incidence or prevalence of the disease. So it's quite complicated, but certainly I think the bottom line is that we're very open to certainly examining all types of testing technologies, because the more tools we have in the toolbox in terms of different types of tests available to use in different types of contexts, the better.
En suivi, j'essaie juste de comprendre si vous êtes favorable.
Follow-up question. I want to know about vaccines and the speed of development. Is it realistic to think that we might have a vaccine for COVID-19 as soon as the spring of 2021? And at that point, how many Canadians should be vaccinated so that it's effective? Answer. So to answer that question, we are always open to using the whole array of tests to see who might be contaminated or might have COVID-19. I imagine that in the future there would be a place for screening that could be used at home. For now, though, it's very important to I'm searching for my words even in English. To make sure technology has been checked, to make sure that the reliability and the characteristics of the test provide reliable results. That was the former question. Now, with regard to when the vaccine might be available, we're very optimistic in the government or rather here in Canada, because there are a number of vaccine candidates that are being evaluated. There are a number of vaccines that are under clinical trials, even phase 3 clinical trials, and there could be an effective and safe vaccine perhaps in 2021. We don't know exactly when, perhaps in the spring, maybe a little bit later, but it's a very good thing to stay optimistic. With regard to the number of Canadians who should be vaccinated in order to have a good level of coverage, well, we don't really know exactly with COVID-19. There are, of course, the people who are at risk of severe consequences. So if we're talking about a group of elderly persons or people who have underlying conditions, well, there, it's very important to take advantage of the vaccine when it comes out. But there's also the question of a community immunity as well. So if people are vaccinated, it gives everybody a better chance to be protected. But we know that science is evolving. We know that also with other infectious diseases like measles, which is very contagious, it was very important to have a very high level of coverage of the vaccine to ensure community immunity. But with COVID-19, we don't yet have enough data to really give an exact figure. But at the end of the day, I think it is important for the highest possible number of Canadians to be vaccinated. That's the best case.
We come back to the room. Operator, over to you.
Thank you. Please press star 1 at this time if you have a question. Veuillez s'il vous plaît appuyer sur étoile 1 maintenant pour poser une question. Et nous avons une question de Michel Lamarche de TVA. À vous la parole.
Oui, bonjour.
Question. I would like to hear about mandatory vaccination. Do you think that it would be appropriate for certain employers or certain schools to say, okay, you want to work here or you want to go to classes here, well then you will have to get vaccinated to ensure a level of protection in our environment? Do you think that that will become a general practice? Answer. Thank you for the question. This is Dr. New. So far, in Canada, we have never made any vaccine mandatory. I think it's better to promote vaccines with awareness raising, show people what the benefits of a vaccine are. I think that it's more important to maybe change people's attitudes who may be more reticent about getting vaccinated, rather than having regulations to make vaccination mandatory. I think that's the best approach. It's the best way to achieve a high level of vaccination in general. We've seen it with the flu vaccine. There are ongoing discussions in the public health domain. What should happen with people who work in hospitals, healthcare workers? Well, I know that there are a number of places where it's always encouraged, but it's never mandatory. However, if there's an outbreak of the flu or of another respiratory tract infection in a hospital, well, from what I understand, in certain places, if the healthcare workers in that hospital are not vaccinated, they cannot work during the outbreak while that outbreak is underway in the hospital. And it's only after the outbreak has been controlled that those employees are allowed to come back to work. So I think that's motivation for all healthcare workers to get their vaccine, their flu vaccine every season, for example? Thank you. Follow-up question? Question. Yes, so we understand that it's not ideal to have a mandatory vaccine everywhere in Canada, but if you take the situation in long-term care facilities, and or if you see a rise in cases in the ICU of various hospitals, well, then there could be something mandatory there, no? Answer. Yes, I think it's the same principle that applies now in hospitals for healthcare workers and the flu vaccine. I know that there's a policy in a number of hospitals to encourage vaccination strongly, but of course there are collective and individual rights at play, and it's always better to have someone who decides to get vaccinated because that person understands the benefits, that it's good for them and it's good for others. But as I understand it, the policy in many hospitals now is if a healthcare worker has not had the flu vaccine, and if there's an outbreak of the flu in the facility, well, that healthcare worker cannot go to work until the outbreak has been resolved. So I imagine that for COVID-19, there could be the same situation in long-term care facilities, for example. So all healthcare workers would be strongly encouraged to get vaccinated if we have a COVID-19 vaccine, but it wouldn't be mandatory. If there's an outbreak of COVID-19, well, then there could be a policy to make sure that only vaccinated healthcare workers can continue to work during the outbreak in a long-term care facility.
I'll turn to the room for the final question. David?
Hi, David Thornton, CBC News. A question on behalf of one of my colleagues. Do you think mask mandates are needed in most cities and municipalities? And this is for Dr. Tam, excuse me.
Well, I think that we, at the federal level, we provide the guidance, but it is actually up to individual municipalities or localities in the public health department to make that decision. Some of it will depend on the actual virus activity in those communities. So the one size fits all doesn't necessarily work. So as I've said before, if you were in the Northwest Territories, it will be very different to, say, Toronto. So I think some of the decision making takes into account the specific context and what kind of settings, what the community is like as well.
So you've offered some guidance, and correct me if I'm wrong, it's not I guess the question I want to ask is, why won't Health Canada recommend mandating masks across municipalities across Canada? I think you've answered that, but if you just, yeah.
Yeah, so the roles and responsibilities for health is decentralized, first of all. So at the federal level, we provide certain standards or guidance. But I think one has to sort of think through the pandemic in its various stages. We got through the initial sort of escalation and wave, and now we're trying to maintain the pandemic at low activity. And one of the concepts is that we can't have just blanket approaches. We need more precision and surgical and targeted approaches, depending, and we like it to be as data-driven as possible so that people can have the information more within their sort of local setting, so that those decisions about public health measures can be done like that. So blanket approaches work to a certain extent for certain phases of the pandemic, but what I think collectively the public health community is trying to do is to become much more targeted in these weeks and months ahead. If things change, of course, public health advice could change as well. So instead of at the local level, there may be provincial level guidance, and then if for federal populations, we can also provide guidance on that front. For example, Transport Canada, that's a federal mandate. So they've put down a policy of mandatory mask wearing on these transports that are federally regulated. So each government has its own set of roles and responsibilities.
Thank you.
Thank you, doctors. So that concludes today's press conference.
Thank you. Merci. The conference has now ended.